My name is Andrea Heckman, and I've worked for Wilderness Travel now for close to 40 years in Peru and Bolivia. And I've dealt with a lot of clients who are coming to high altitude. And we go up as high as 16,000, 17,000 feet. So this is my dear friend, Dr. Quigley Peterson, the founder of the Mogul Medical Clinic in Taos Ski Valley. And our base area is 9,200 feet. Our lifts go well over 12,000 feet. So Quigley and I have talked over the years. He's been good to talk to me. And you want to say a bit more about what you do in Taos?
Well, I feel blessed to take emergency medicine experience and put it in a clinical setting at Taos Ski Valley. And it's so wonderful to take care of athletes and motivated people who come to altitude and want to perform.
Mm-hmm. And so besides Taos Ski Valley, you've traveled extensively at very high elevations.
Well, I've been
right?
blessed to be in the Himalayas 3 times, in the Andes several times as a trip doctor. So we've seen a lot of things come down on those trips.
Yeah.
And I've learned a lot.
So when people arrive in Peru and Bolivia, as well as Nepal and other very high elevations, let's just go to the basics first. What symptoms might they feel?
Well, they're going to probably be thirsty, because going to a place where it's really dry and they just spend 6, 7, 8 hours in an airplane, which is drier than the Sahara Desert. So they're showing up dehydrated. They're often showing up exhausted because they work too hard. But the things to watch out for are not sleeping well, which should not happen after a long, arduous trip, and loss of appetite. Those are the first symptoms. And if those progress to nausea, vomiting, headache, especially after the second night, those people, in our experience at 9,300 feet, definitely need medicine, because it's going to get worse. If you're up higher, everything is exponentially accelerated, because it's a logarithmic curve instead of a linear curve. Let's just talk about what causes altitude sickness. What causes it is low oxygen in your blood when you're sleeping. Some people have that low oxygen state all night long, and they sleep through the night and they just wake up feeling not good or not having an appetite. Other people wake up a bunch of times, they're short of breath. So that's one of the reasons people have a problem with their sleep when they're at altitude. Yeah. So that low oxygen state makes you feel terrible, and that is happening on a physiological level in your body. The way we diagnose it in our ski clinic is to give someone 15 or 20 minutes of oxygen, and if that makes you feel better, if you have access to oxygen where you are, and that makes you feel better, you need medication. But back to your question about the hyper-competitiveness of it, is that low oxygen state really can't be fixed. If you're dehydrated from vomiting and diarrhea, we will give you a couple liters of fluid. You need an hour or 2 of oxygen to get just back to the normal state, but when you go to sleep that night, you're going to go right back where you were. And the beauty of this medication, Diamox, is it stimulates your breathing response in your head when you're sleeping. So you run a higher oxygen saturation during the night, and you wake up feeling more rested. So if you even have a little bit of a sleep disturbance, to get back to your question, and you're a little bit low during the night, but not enough to make you sick, you will not have any resilience. You will not have any reserve. And if you are hyper-competitive and you want to be the first one over the pass, it's likely you will be miserable.
So just to switch the topic a little bit, people also say, hey, are altitude problems hereditary? Is it related
Well,
to
actually,
age?
they are. They are hereditary, and this is fascinating, because some people come to altitude and they are just fine. But you can be a marathon runner and come up here and do very poorly, and you can be a big, overweight couch potato and be happy as a clam up here. That's just the way it is. But there's a gene that affects how your brain responds to low oxygen in your blood at night, and we don't need to go into the details, but if you have that gene, you have that gene.
So another question is, hey, if it happened to me once, is it going to happen every time I go up?
It tends to recur at the same altitude. It's fascinating. We'll have people come here and say, oh, I've never had altitude sickness before, but they never had been as high as Telluride or Taos or Breckenridge. They'd been to Vail, where you don't sleep as high. So that's where people get schnookered. They don't sometimes think about the elevation at which they're going to land and go to sleep. But that makes me think of a question you had talked to me about once in the past, was about caffeine. Now, people say caffeine dehydrates you. I would say yes and no. If you drink an 8-ounce cup of coffee, it will make you urinate maybe 30% of that. This is the physiology that I was taught. I might be off by 5 or 10. But it doesn't get you into a negative balance. But you didn't take 8 ounces, you took 5. And the other thing is, if you can take caffeine and go to sleep at night, I wish I could, then you should do all the caffeine you can at altitude, because actually caffeine stimulates your respiratory drive center in your brain, just like Diamox does. But we don't typically put it in the recommendations because it just confuses people.
And would you just go over the sleeping pills again? Because this is a really big concern, because at home somebody has that little sleeping pill that really helps them, and it's very scary.
Well, first of all, if you're on a trek,
altitude.
you're going to be a little more tired when you go to sleep, which is a good thing. I would say the sleeping pills and alcohol blunt your, what they call the hypoxic ventilatory response. That's your unconscious ventilatory drive, and anything that does that is more likely to have you run a low oxygen saturation in your blood at night and make you feel not very good the next day.
So people often say, hey, I've been training for this trip, I've been running, I've been hiking, and it's sea level or low elevations. What should they do to prepare? Because they like to say, hey, I'm in great physical shape.
It's fantastic to prepare if you're going hiking or trekking on a big trip, and whether that's at the gym or going running or being on a bike or even hiking, it's an awesome thing to be able to do. But you can't prepare for the altitude unless you're there. Or if the standard recommendation is to go up 1,000 feet a day and you'll be just fine. Well,
So-
in the modern society, that isn't super practical.
We have friends from sea level who actually come to Taos and hang out here for weeks or a month if they can at 9,000 before they fly into La Paz at 12,500. Is that a good thing?
Oh, that makes sense. We have a
Yeah.
lot of patients who come to Taos Ski Valley who stay in Santa Fe, which is 7,000 feet for a couple nights. They love Santa Fe. It's a fun place to hang out. And that gets their body used to going up another 2,000 feet. And I would make the same case for La Paz or Lasha or any of those places, that getting there a couple days early to help you acclimate is going to make you have a better trip. But the bigger thing is, in my experience, whether they're coming on vacation, tourists to Taos, or going on these other trips, they burn the candle at both ends, they work the 60-hour week, and they show up exhausted, and they want to get after it the next day. And I would strongly encourage you not to do that.
People arrive and say, my doctor at home, who I just love and respect, my doctor at sea level, has told me I don't need to take meds. I don't need Diamox, for instance.
Well, I would answer that by saying I don't take care of diving injuries. I can't tell a doctor in San Diego how to treat something like that. If you're not up here and you haven't seen it, you don't really know. The medical reference books give all different doses of Diamox, and we see people coming with way too much, get way too many side effects, get way too much dehydration. And so I think it's super important to be on the lowest effective dose that there's medical science behind.
And you need to begin before you arrive.
If you've had altitude sickness before, just come into Taos. We have them start at 125 milligram dose twice a day, the day before they travel, and most of those people do just fine. Because the other thing Diamox does, besides helping you have a better respiratory response when you're asleep at night, because the respiratory response is in your midbrain, it's the primitive reptilian brain, it also facilitates acclimation. So if you do have symptoms, and that process takes a couple of days, but we kind of bypass that. It's like an end around. If you take that medicine the day before you travel, it's almost like cheating. But sometimes it's okay to cheat. That's how I look at it.
So what if I get there and I think I'm not taking that Diamox, I don't need it, but you start getting symptoms? Does it help?
If you have never been to 12,000 feet, I would recommend at least having it with you. You don't have to take it. It's not expensive. It's super safe. And because if you need it, you need it. And that said, most of these countries, you can go to a pharmacy and buy it. The bigger issue is if you've had it before at 9 or 10,000 feet, it's going to be worse. if you go higher. So why not take the medicine, get there early, and have a wonderful vacation?
Okay, there's another question that comes up, and that's, I've been at high altitude for 5 days now, and I've taken the Diamox and I'm feeling really good. But I'm going to stay at 12,500 at least, or even go higher. Should I go off of
That's
it?
a fantastic question. What I would recommend is once you've slept 2 nights and you're feeling fine, eliminate the morning dose and still take the nighttime dose. And if you're still doing okay after 2 days, then stop it. You don't need to take it the whole time. That's
Okay,
what you're
yeah.
getting at, right?
Yeah, it is.
So typically on a trip like this, you need it for 3 or 4 days. So I typically prescribe 12 pills. So that's twice a day for 3 or 4 days, and then at nighttime for a couple of days, and you still have a couple left over. And that's usually enough.
What if you're going to go as high, maybe your 10th day of the trip, you're going to go up to 16,000?
Then the night before, I would
ahead.
take it, and I might take a morning dose depending on how I feel. If I had a little headache or whatever.
Yeah.
Also depends if you're going to go down. I remember the very first time I had altitude sickness was going out of the pass in Manang in 1980. And it was a high pass, and I was in great shape, and I got this wicked, wicked headache.
Yeah.
At about 15,000 feet, I didn't have anything else, and I thought, what in the world is going on? I was running marathons. And it wasn't until I was at about 15,000 feet on the way down that I realized, oh my God, that was altitude sickness.
So quickly, we've talked about a lot of different things, and let's just summarize it for the folks who are about to travel.
Okay,
Yeah.
So what are the bullet points? Show up rested, show up in shape, super helpful. Hydrate. If you've had altitude sickness in the past, do take the Diamox, or at least bring it with you. If it worked at 9,000 feet, you're going to really need it at 11. You had mentioned getting there early.
Yeah, definitely. We can't stress it enough to come a day or two early and enjoy and get into the culture and where you are. And you'll just be amazed, especially Cusco. People always say, I wish I had known, but think of Kathmandu or all the things on this trip. And there's another reason to come early, because as much as we trust our airlines, you keep your hiking boots with you on the plane, but luggage sometimes comes slower than people. And you need that extra 1 day buffer while you're enjoying the city.
Have your medications and your hiking boots with you on the plane, and drink more water on the plane too. Remember, it's the same dryness as the Sahara Desert on an airplane. It's 4 to 5% humidity.
Yeah.
So on an 8-hour flight, every time you breathe out, you're breathing out moisture. So just drink tons of water. If you have to pee more, so what?
Okay. We're done.
Okay. Anyway. Oh, hey,
you.
hey, have a nice trip, folks.
Yeah, enjoy your travels.
All right, there we go.